At her young age, Mariam has already become a victim of rape. It happened in September 2019. She hadn't yet celebrated her 5th birthday. After the many interrogations of her mother, Fatou, Mariam finally told her that she had been raped by a neighbor who had threatened to kill her if she told anyone. Fatou still can't believe it. It is a shock for this mother who was already recovering from a road accident. When her grandmother started to wash her, she started crying and said that she was injured and that her grandmother shouldn't wash her sex. She then went to the room and I made her lie down and I saw that she was injured. So I started to ask her, "Who did this to you?" She was afraid, so she started to lie. And she said that she fell on a rock. I felt so scared. I was even shaking. It shocked me so much, I couldn't even talk. At the time, it was my mother who looked after me. I started crying. I didn't know what to do. In fact, I was already ill because I had had an accident 2 weeks before this happened and I was bedridden. So, because she was crying so much, I got up and I went to see what had happened. The presumed rapist, a neighbor, has been arrested but has not yet been judged. This morning, Fatou and her daughter have an appointment at the one-stop center in Bamako, a center providing care for gender-based violence set up by the UNFPA and its partners, Spain and Canada in particular. This is Fatou's second visit. Really, this center do their job well. They welcome people well, and they are very nice with people. I knew of this center. When I went to the police to report the incident, they referred us here for consultation for the child, to evaluate her health, if she was well or not, if she had received any infections and how to treat that. We were really well received here at the center. The one-stop center is situated within the reference health center of the Commune 5 of Bamako. It cares for survivors of gender-based violence, or GBV, which is unfortunately part of the harsh reality in Mali. Between 2012 and August 2019, medical and psychosocial care services recorded close to 15,534 cases of GBV in the areas directly affected by the security crisis which prevails in the country.
The
one-stop center is a single-window approach, and in Bambara it is called ECG, which means welcome and take a seat. There are 4 types of services provided at the one-stop center: psychosocial assistance, medical assistance, security assistance, and legal aid. In the Malian context, the one-stop center has opened because of the problems related to gender-based violence. There are 6 types of gender-based violence that we care for here in a holistic manner: rape with penetration, sexual assault, physical violence, psychological violence, denying resources, and forced marriages. These phenomena are frequent in our society, but because of the socio-cultural context, those who are victims of gender-based violence often hide it.
Et en fait, avant, ce qui s'est passé, c'est que il n'y avait pas un centre.
Before, we didn't have a holistic service center. Women in Mali would come to the healthcare center to receive care, and they would explain to the doctor what happened to them. Then the woman would be referred to the police, where she will have to retell her story, and then they would refer her to the lawyer, where she would have to tell the same story again. So we noticed that this didn't work very well because the woman wouldn't accept to go to all these places to tell the story over again. So that is why we have opened the holistic center. This center has made it possible for the women to tell the story only once. They then receive the medical, psychological, security and legal help all at once.
Médico, psychologie, juridique et sécuritaire.
This morning, Amina is taking to the center her 14-year-old daughter, a survivor of gender-based violence. Aisha, who has poor mental health, was raped in September in Kalabamkoura, a district of Commune 5 of Bamako. The first stage of their marathon in the one-stop center is the reception desk. Here, the survivor is listened to, reassured, informed on her rights and the services available, and, if needed, she will be directed towards other services. These are persons who need our help. They come here, and as they are taken care of here, they progressively regain their confidence. After the first contact, I ask them for their approval, because without their approval, I can't do anything. So I ask for their approval, and then I fill in the form. Once I have done that, I direct them to the doctor. Some need psychosocial care. If they need that, I will call the psychologist, who will provide the psychological care, and the doctor will provide the gynecology care. There are survivors who come without a police requisition. Most women go to the police first and get a requisition, but some come here directly. So for those who come here without going through the police, I will ask them if they want security support. If they say no, I leave it. If they say yes, I will call the police for them to provide the security assistance. Next stage, the medical consultation. Amina and her daughter are directed towards the medical department. Here, she will do a number of medical tests.
Vous venez d'assister à la prise en charge d'une survivante de viol.
You just witnessed the management of a survivor of rape who is 14 and who is also mentally ill. She has come here with her mother. At the end of the examination, you saw that we asked her to have an HIV test. The purpose of the HIV screening test is to know if she was seropositive before the event. She will take this test 3 months later. We also did a urine-based pregnancy test, and the objective is to see if she is pregnant today. And after all of that, we did some lab tests, and we prepared the form for all of these lab tests that need to be carried out. And at the one-stop center, I can guarantee that all the services are free. We also gave her a pill, and this is an emergency contraceptive pill. The objective is to prevent unwanted pregnancies in the cases where the sexual rapport coincided with her ovulation period. The objective of the echograph is to see the state of the pelvic organs as they are today. The next stages are the security care and the legal assistance. However, we will not attend these stages. But the center coordinator told us about the procedure.
This depends on the care services. The interested person is free to choose the security assistance. They are also free to not choose it. We respect the choice of the survivor. If they choose to have security assistance, then the police are here to assist them with security, and they'll explain to her that she can continue the legal procedures and that she can have the help of the legal assistant who will explain the pros and cons of her choice. And when the police will have explained how the security and legal insurance happen, the interested person will decide if they will continue the legal proceeding or not. But in each case, we respect their choice.
Later, we found Amina and her daughter, who had come out of the security and legal consultation. At the reception office, they receive what they call here a dignity kit. The dignity kits are kits that we give to the survivor, especially for cases of rape, because we have survivors who come here and who are still wearing the clothes that they wore during the rape. So we give them the dignity kit as part of the care service we give them, and we provide them with toiletries and hygiene. So there are shoes, t-shirts, there are even waistcloths, hygienic cotton, toothpaste and toothbrush, a torchlight and body lotion. Since its creation in 2017, the One-Stop Center of Bamako has receptioned 375 cases of gender-based violence. On these 375 cases, only 40 were the subject of legal proceedings. On the 40 cases of legal proceedings, only 17 cases were the subject of a detention warrant. Indeed, the survivors are afraid of reprisal from the perpetrators and of stigmatization and rejection by their communities. Furthermore, most of the problems concerning families are negotiated and solved by traditional leaders in the absence of administration and security or legal systems.
Pourquoi? C'est pas parce que, comment dirais-je,
It's not that the survivors don't choose to take legal pursuit, but it's that during the course of the legal procedure, the problem gets solved within the family or within the community, all this to avoid the social weight and stigmatization of the victims. It's an obstacle to the efficient fight against gender-based violence. I think that on that point, there are activities to carry out upstream, such as sensitizing activities, providing information on human rights, women's rights, children's rights. All this should be done within the communities. In addition to that, the projects and programs should integrate the response to GBV in the development of these programs.
There are two operational one-stop centers in Mali, one in Bamako, the other in Mopti. On the government's request, they were set up following Rwanda's model. In Rwanda, the centers are located within the buildings of the police force, whereas in Mali, they are situated in medical institutions. Indeed, the survivors are often reluctant to go to the police. In 95 to 97% of the cases, according to the data of the Information Management System on Gender-Based Violence that the UNFPA manages.
Ces projets tiennent compte d'une femme.
These projects include women and put women at the heart. Women need to empower themselves through information. They need to know their rights and need to know how to exercise their rights. And they should be able to work and earn a living, and they should have access to reproductive health care and family planning. Once a woman is empowered, we also work with the community to make sure that the community supports women. In the community, there are traditional leaders, there is a community and the religious leaders. There are men, boys, all these persons need to support the women so that they can be empowered. On the other hand, there are the services. I mean by this, the holistic service center that provide the services. So there are three aspects: the services, the women in question, and the community. This is how the project is organized. As for all projects, they need to be monitored. We need to have data in order to draw conclusions. Have we been successful or not? And in order to make sure that GBV is completely eliminated in Mali, that is, a Malian woman is 100% protected from gender-based violence, there naturally needs to be an information system. So this support system is part of our project so that we can make sure that we have information to monitor the tendency and see whether it is increasing or dropping.
Est-ce que c'est à la hausse ou c'est en train de baisser?
In 2019, from January to August, the Information Management System on Gender-Based Violence recorded 2,143 cases. 97% of the survivors are women and girls, and 2% are boys under 18, and 1% are adult men.
Les violences basées sur le genre.
I would say that gender-based violence here in Mali is a question related to our social context and is often expressed in family and in public spaces. Today, however, domestic violence has increased. I would say this was following the crisis in Mali. This violence that would take place in our families were hidden and were covered by family safety nets, so to speak. Now, following the crisis, these safety nets were dropped, and this violence has ended up happening in the streets, through social networks, on the workplace. So, since there are no longer any safety nets, everyone can now do what they want, so to speak. And also, we have witnessed a proliferation of light weapons. Today, in our families, there are murders of the spouses, male or female. And this is something we rarely encountered before, which means that GBV is more and more expressed here in the Malian society. In Bamako, the NGO FEDAF, which stands for Women, Rights and Development in Africa, undertakes studies, research and actions on women's rights and their participation in development. They have received several cases of GBV, which they have directed to the One Stop Center. From 2009 to 2017, the NGO recorded more than 1,100 cases. When we are referred a victim, we make sure we follow up on the victim and enter her data in our database. The partnership with the One Stop Center is a fruitful one because each time we call and refer someone, we can feel that they are available and keen to take on the person. Now, the challenge we have is that the One Stop Center is not a shelter. Because sometimes there are women who have been victims of violence who need 1 or 2 days to come to their senses before they can move on. So we feel this type of shelter is missing here, and it's something that we are thinking about together so that we can find a solution. Apart from that, on the whole, it works really well. It really is a useful instrument for us that we use throughout the day because each day we refer at least one person to this One Stop Center. In the FEDAF corridors, we meet Ramata, a survivor of gender-based violence. Ramata was abducted for several days in northern Mali by jihadists who sexually abused her. While she was trying to flee her hometown at the beginning of the conflict in the northern area of the country, she was stopped by an armed group. They took all the men that were in the car, and to this day we have not seen these men. That's from April 2010, and to this day we haven't seen them. My little 28-year-old brother was amongst them. Until now, as you see me here, we haven't had any news from them. We don't know if, I don't know what happened to these men there. When I was taken, they put me in a car and took me to a place I don't know of, to leave me there. I found tents there. There were men in the tents. I don't know if that was their leader or what. So when they took me, I refused to go. I even bit them in the arm. They hit me. I hit them. They managed to force me into the car. They hit me here in the back. I got ripped open. You can see the scar still. So they took me to their leader there and made me go into the tent. And he was the one who raped me. For more than 1 week I was with them. More than a week. 10 days or more I was with them. A child was born from the repeated rapes. A child that Ramata struggled to accept. I gave birth on the 5th of January, the day the French left France to come fight the jihadists. It was a Friday, I can't really remember, but it was the 5th of January 2013. I gave birth to a boy. When I got pregnant, people started to talk about me. There were rumors. One man heard this, he's not even Malian, but he came to see me and he asked me what he could do to help me with what happened to me. I explained all that happened to me, and the man helped me. He provided for me. He took me to the Korofina hospital and looked after everything. He paid for all my medications. The day I gave birth, he came to the hospital as well to pay everything. When the baby came, I said, I don't like that child. I will never keep the baby with me. It was very hard. Ramata is amongst the 88 women who lodged a joint complaint for rape against the armed group in northern Mali. The case is pending before the Malian and international courts of justice. This sexual violence has been treated as infractions related to terrorism infractions. So we said that the women who were victims of these grave violations should not be judged against terrorism-related infractions. These are infractions in their own right, and this was recorded. The National Assembly in Mali adopted a law to enlarge the mandate of the anti-terrorist pool, so that this pool also include sexual violence linked to conflicts. But we continue the advocacy. We would like one special chamber to be created in this anti-terrorist pool to recognize this sexual violence. And we said that we don't want these victims to access justice on an international level, but rather that the government of Mali should take the appropriate disposition to hear the victims and hold proceedings here in Mali, so that all the victims who wish so may have a hearing here in Mali. According to the Mali Demographic and Health Survey, over the 2013-2018 period, 45% of women and girls from 15 to 49 years state having been subject to sexual or physical violence. And in a climate of impunity and the absence of the rule of law in certain regions of the country, the responsibility of the perpetrators of gender-based violence is seldom recognized.
Thank you.